Three most common questions I'm asked when people are looking into having full arch dental implants done. One, is dental insurance going to cover it? And my answer to them is no, it doesn't. But my office will work with you to find a way to make it affordable for you. The second question they ask is, will it hurt? My answer to them is that most patients say that it was more uncomfortable having the teeth removed than having the dental implants placed. Generally, we handle the post-operative pain with over-the-counter medications like Tylenol or Motrin. The third thing they ask is, will I go without teeth at any time? And my answer to that is, we would not let you leave this office without teeth. We have different options that we can use for it. It just depends on the individual situation. The big benefit of having full arch dental implants is that it replaces your chewing efficiency to 90% of what it was when you had your natural teeth. What that means to you is that you will smile naturally, you'll eat healthier by being able to chew more effectively, you'll be able to digest your food better and get the full effect of the nutrients in those foods.